Honourable Deputy Speaker, Honourable Members, I rise to address the questions raised by the Honourable Member regarding the procurement practices and staff welfare within the Ministry of Health and Social Services. I want to assure the August House and the Namibian people that the Ministry of Health and Social Services is currently committed to upholding the highest standards, that is, of transparency, accountability, and ethical conduct. And in cases where that will be highlighted throughout the answer of the question, where you will note that because of the fact that certain specifications were not given, it was difficult for the team to probe out which exact instances were being discussed, considering the fact that the companies that were mentioned were not necessarily used on a once-off sort of instance. And so therefore, I will provide the answer to the question, but would definitely recommend to the Honourable Member that where details can be provided as to the particular instances, dates, and times where the procurements were done, that would help to be a little bit more specific. With that said, Honourable Deputy Speaker, Honourable Members, question 1, it is essential that we, as I mentioned, provide the necessary specific details. Now, the Ministry operates under the mandate of saving lives, and yes, sometimes it does necessitate emergency procurement. I myself, during my tenure, have engaged in emergency procurement in instances whereby the normal process would just take too long and lives were at risk. And therefore, yes, it is a practice that is undertaken in the Ministry in certain instances. However, due diligence must be practiced in such instances, and we recognize this. Emergency situations are handled or supposed to be handled in accordance with established protocols and exemptions and reported to the procurement policy unit within the required time frame. Is this always the case? No. Should this always be the case? Yes. Have we had instances that it has been reported that this process was not followed? Yes, and we have taken them to task. Without specific information, a comprehensive response is impossible. However, we do encourage that despite the fact that the direct examples be provided, I want to place it on record. When the Ministry undertook to procure pharmaceuticals through long-term contracts under the Central Procurement Board of Namibia, which we assumed was part of what was being alluded to, this activity was stalled through a court interdict, which persisted until a favorable High Court judgment in May this year, 2025. During the intervening period when the matter was before the courts, emergency procurement, combined with some limited pooled procurement, was undertaken through regulatory exemption and related accountability provisions in terms of the provisions of the Procurement Act. No impression should be gained that the procurement activity was not guided in terms of the relevant policy provisions. Regarding question 2, we reiterate the need for specific examples. However, all procurement activities are advertised on the EGP portal as required. We have gone as far as placing it on record that the Ministry has instituted investigation, including investigation by the Anti-Corruption Commission into the affairs of certain units of the Ministry. And so a lot of the questions allude to, are we aware that these has been taking place or that it has allegedly been taking place? And on that, I wish to state that it has been put on public record that we have noted some irregularities in certain units in the Ministry of Health and Social Services, and those investigations are currently underway by the Anti-Corruption Commission. But also allow me to allude to the fact, as I try to summarize the answers, allow me to also allude to the fact there was a question that referred to the need for auditing. The Ministry has taken these necessary steps. There is auditing taking place as we speak, although there has been some resistance here and there. The goal is to say if there's nothing to hide, you should be open and okay with being audited if the necessary processes have taken place as they should. With that said, regarding question 3, Honourable Deputy Speaker, Honourable Member, workplace environments must be conducive to all staff members, and these instances are handled through human resource and administrative functions where there are complaints. I would expect that genuine concerns should be addressed through the necessary structures, and it is regrettable if a staff member feels the need to raise concerns outside of that when they feel that they are not being heard. It is important to note that in the past ±3 weeks, I have received a few of these complaints directly to my office. About 1.5 weeks ago, I met with a member of one of my units who was complaining and requesting to be shifted because of what you've mentioned, bullying, targeting, and all of that. With that said, we take note of this particular question and wish to highlight that we recognize that the current stance and the current state of affairs regarding the safety and the security that we provide to staff members of the ministry must be re-looked at, and in certain instances completely overhauled, to ensure that where staff members do not feel safe, where they are being bullied, where they are being targeted, they are able to report it, but also that they are able to get the necessary responses in a timely manner. Because one of the issues that has been raised is that despite the fact that they sometimes raise these issues, because of the bureaucratic processes, it can take up to 1.5 years for anything to be done. And those are the things that we are currently working on to reform. Regarding question 4, as previously stated, the Ministry of Health and Social Services operates in an environment where emergency procurement situations sometimes do arise. When such emergencies occur and essential products or services are unavailable, immediate action is necessary to save lives. I wish to reiterate at this particular point, although my time is up, that particularly with the procurement processes in healthcare, we must remember that healthcare unfortunately does not function as any other ministry because of the fact that the services and the drugs are oftentimes life-saving, and therefore time is of the essence. All exemptions provided in terms of the provisions of the Public Procurement Act and all emergency procurement undertaken are underpinned by accountability provisions and should be underpinned by accountability provisions. Have we had instances where this has been strayed from? Yes. We recognize that, and as mentioned before, there are units that are currently being investigated, and there is an active pursuit of auditing taking place. Delegation of powers have also been tightened to ensure that risks are effectively managed. And then with regards to the last question, I'll summarize the last 2, 5, and 6. Honorable Deputy Speaker, a bid evaluation committee is a technical committee comprising staff members from various units of the offices, ministries, and agencies. This is in compliance with the provisions of the Public Procurement Act. Having a staff member from the user department as part of the BEC is not inherently problematic as decisions are made collectively. However, this is not particular to the Ministry of Health and Social Services. Information on the internal structures and the pool of bid evaluation committees per offices, ministries, and agencies is readily available. While external participation is valuable, it is not mandatory in every procurement process. However, we recognize the need to ensure that particularly with these committees, we try our very and utmost best to ensure that there is no conflict of interest. And that is something that we are taking on head first. The last question, Honorable Deputy Speaker, Honorable Member, the Ministry of Health and Social Services does not operate on a basis of arbitrary staff reshuffling. However, staff movements may be considered to optimize operational efficiencies, to leverage strengths and minimize weaknesses. We do discourage the personalization of issues and encourage objective teamwork among staff members. Addressing any instances of victimization will be handled procedurally in line with the Public Service Act number 13 of 1995 and its Code of Conduct. Where necessary and shuffles are needed, I wish to highlight in conclusion to the Honourable Member that those necessary actions have started. We have started reshuffling where necessary. Some of that perhaps not announced to the public, but we have reshuffled, some of them within the particular units that we are discussing, and some of them still to come. I thank you, Honourable Deputy Speaker.
Thank you.